Good morning, student. Today's lecture is on a case study in biomedical ethics involving Professor Simon Shorvon. Professor Simon Shorvon was well known in Singapore because of one of the ethical problems that he created some time back. And you probably have heard of Professor Huang in Korea that actually cloned a puppy, Stumpy here, and he actually created some ethical problem. So that Professor Simon Shorvon is a Singapore version of a case study of the ethical problems. The background is he's actually a top neurologist. That means that he's a doctor who specialized in nerve diseases. He joined Singapore National Neuroscience Center in the year 2000 as his director. But in 3 years' time, he was found to commit an ethical breach of trust in his work. What did he do? Well, at the time he was sacked as a head of National Neuroscience Institute for recruitment of patients without attending physician's permission. So what happened was, although he was the director of this organization, he is not the one who is in charge of some of the patients, but he actually recruited the patients without the patient's doctor's permission. And when administrating the drug, he did not get the patient's consent. And on top of that, when he's doing the research, one of his assistants is actually not a registered doctor in Singapore, and that person is actually adjusting the dosage of the medicine for the patient, and that is illegal. So because of this ethical violation, he was sacked from the National Neuroscience Institute, and there was a formal inquiry conducted by the government, and he was also found guilty by the Singapore Medical Council, which actually governs the doctors in Singapore, and he was fined. And his assistant, who was not a registered doctor, has actually left the country. Why is it a serious offense in this case? Because there was a breach of confidentiality. There is a doctor's and patient's professional relationship which is confidential. So as Professor Simon Shorvon is actually not the attending physician, he actually breached the confidentiality by looking at the patient's case notes and interfering with the study. And he did not inform the patient's doctors that he is actually assessing the patient's records. And the patient's consent that we have learned in earlier chapter is important because in all treatments, patient consent is required. And in his research, he's actually adjusting the dosage of the patient's medication without their consent. And by adjusting their dosage, you actually may cause harm to the patient if the dosage is increased, or it may actually cause less cure to the patient if the dosage is decreased. So all these things must actually be obtained consent from the patient itself. And the other thing about his assistant is, his assistant, although is a medical doctor, he was actually practicing without license in Singapore, and that is actually illegal because in all countries you must have a license by the country itself to be able to practice medicine. So in this case, his assistant was actually practicing illegally in Singapore. So what did we learn from this case? We learned that there was an important role for the hospital's independent ethics committee to monitor all clinical research in the hospital and to investigate immediately ethical breach of trust. So that was a learning from this case. And of course, all doctors who conduct study would have to know what is the ethical conduct that's required. And hospitals should also put in safeguards to ensure doctors who are not involved in the case are not allowed to access the case notes of these patients. We look at discussion topic. Imagine you are a biomedical engineering working in a hospital to provide technical support for the new dialysis machine. You found that the doctor who is performing dialysis to the patient is conducting his own research by adjusting the dialysis volume without telling the patient. What would you do? Thank you.